enter the room.
Hello, I'm Dr. Anmali, one of the doctors in the GP surgery. Can you confirm your name and date of birth for me, please?
Hello, doctor. I'm Nolan Booth and I'm 35.
Okay, how would you like me to call you today?
Nolan is fine.
Hey, Nolan. Nice to have you here today. How can I help you?
Doctor, I'm planning a trip to Africa and I would like to get some antibiotics, just in case I get diarrhea whilst I'm there.
All right. Thank you for letting me know that, Nolan. So before we discuss about the antibiotics, can I just ask you a little bit about your trip? So when are you planning to go on this trip?
In a month's time, doctor.
All right. And how long are you planning to stay?
For about a month.
All right. And are you going alone or are you going with friends?
I'm going with my wife.
All right. Okay. And so can I just know a little bit about what your plans are, like what the things that you're planning to do, what kind of activities you're going to do there?
Okay, well, doctor, I want to go and film a documentary in the rural areas there.
All right. Okay. And have you thought about how you're going to take your meals and water and everything?
Well, I'll just use whatever is there.
Okay. All right. So you said you wanted some antibiotics. Can I know why you want some antibiotics for the trip?
Well, doctor, I've traveled to Africa before, and last time I got a really bad traveler's diarrhea.
Oh,
So
okay.
I'm worried. Yes.
Mm-hmm. And can I know what happened last time when the traveler's diarrhea? Did you what happened?
Well, I developed the diarrhea and I had to get admitted, doc.
Oh, okay, right. So, all right. So this time you're going to the same country. Is that the same area? Is that correct?
Yes, I'm
Oh,
going to Nigeria.
all right. Okay. So, Nolan, so you said you're going with your wife. Do you or your wife have any medical problems that I should be aware of? Any long-term medical problems?
No, doctor.
Okay. Are you taking any drugs, any long-term medications like immunosuppressive drugs or anything like that?
No, doc.
Okay. And do you have any allergies to any medications?
Not that I know of.
Okay, right, Nolan. So, if I understand correctly, that you're going to Africa for 1 month and you want some antibiotics just to get to prevent from any traveler's diarrhea. Is that correct?
Yes, doctor.
Okay. So, can I just ask you what you understand by traveler's diarrhea? Do you know how it is caused and how it is spread?
Well, I know it's an infection that you can get through eating maybe food or
Mm-hmm.
drinking contaminated water.
Yeah. Okay.
Yeah.
Yeah. So, why do you think you need antibiotics? Is it to take when you get the diarrhea, or do you want to get prevention? What is the main reason for you to request antibiotics at this stage?
Well, in case I get a diarrhea, I need to have something, like these African countries. Maybe I won't have access to medical care when I'm there.
Mm-hmm. Okay. Okay, right. So, thank you for sharing that with me, Nolan. So, do you have any other concerns or any worries that you would like to share with me?
Well, just the antibiotics, doc. I need to be
Okay,
prepared.
right. Okay. Anything other than that you expected from this visit?
No, just the prescription.
Okay, thank you, Nolan. And also, I would like to ask you a little bit about malaria. Have you ever taken? Do you know about prevention of malaria and the pills that you can take for when you're going to African countries?
No, doctor.
No. Okay, right. Thank you for that, Nolan. So let me discuss about your concern here. So you want some antibiotics to in case you get traveler's diarrhea. So I understand that the hygiene and the food is going to be a problem for you, and there's a risk of getting some infectious disease like diarrhea. So like you said, it can spread from contaminated food and water. Usually it's caused by bugs like bacteria or sometimes parasites. Um, so I understand that you have a concern because you have had the infection last time as well. But the thing is, at the moment, our guidelines say that we can't issue antibiotics like as a preventive method. Is that clear to you?
No, doctor, I'm
Yeah,
not trying to
yeah,
prevent. I mean, in
right.
case I get diarrhea,
Yeah,
it won't be to prevent, it's to
mhm,
treat when I get it.
right. Yeah. So, well,
2 minutes
at the
remaining.
moment, there's no possibility of me to prescribe an antibiotic without a proper reason, Nolan, because we only prescribe antibiotics if we can see the patient with symptoms. So, unfortunately, I can give you some suggestions so that you can be better prepared for this trip. Like when you're going to the Africa, you can always like find out the medical care, the medical support available there, and also there's a special uh, advisory service called health advice service. So you can I will refer you to that. So they will also give you some more advice. Um, is that all right with you?
What kind of advice are they going
Yeah.
to give me, doctor?
Yeah, so they will give you advice regarding how to maintain like proper food and water hygiene and how to, I mean, specific, you can get advice specific to the country that you're going. And also they will give you advice on malaria because it's important that you take some tablets to prevent getting malaria because these countries have are very common to have malaria infection as well. Um, so what I would like to advise is maintain good hygiene, good hand hygiene and food hygiene, and make sure that you are in touch with the medical services locally. And there's one thing that I can suggest is you can get some antidiarrheal medications from the over the counter from in the UK, where you can take if you have like severe diarrhea. But that also you have to be cautious and not take it if you have any fever or bloody diarrhea.
Move on to the
Um,
next station.
okay.
Thank you.
Yeah. Okay.
Thank you, Dr. Parable, for this
Thank
information.
you.
All right, let's quickly discuss about this case. So this is a patient asking for antibiotics for travel to prevent any infections of the gut and that cause diarrhea, right? So Dr. Almali did mention quite a few points that were pretty good. In fact, understanding the place is very important. Understanding the activities that they will be engaging is very important, and understanding the kind of food that they will have, that's also pretty important, right? And one thing about diarrhea is, I mean, they are requesting for antibiotics. How are you so sure that if at all they have an infection like traveler's diarrhea, how is it so sure that they would be getting it from a bacterial infection? Right, you're only getting prophylaxis. I mean, you're only taking medications for bacteria. So every time you get diarrhea, what if they take the medication which is antibiotics, but it's not a bacterial infection? Then it would just render it ineffective, isn't it? So the best thing to actually do is give them advice against what to look out for and when to actually seek medical attention. And more importantly, tips to prevent that thing from happening. Right. So there can be a lot of practices, hygiene practices that they can use, and also direct them for proper vaccinations. Right. So you did mention that the Center for Travelers, right? So there is a center for the National Travel Health Network and Center. So you can actually direct or refer them to these centers, which is usually covered by the NHS. And they may actually give you certain tips pertaining to the place that you travel. Along with that, certain vaccinations that are very important to take. Right. So you specifically asked about malarial vaccination, which, yep, of course it is prevalent, but there are so many other, infections that are prevalent as well. What about them? So good open question to ask for this is, have you taken any vaccination for your upcoming trip? Right. Have you taken any such health measures? Yes, Dr. Ranmali, go ahead.
Yeah, it's actually specifically mentioned in the candidate information to ask about malaria prophylaxis and
Okay.
other vaccinations as well. Yeah.
Yeah. All right. Yes, definitely. Definitely perform what is expected out of you in yes, yes. This is good. Always make sure to cover everything that has been mentioned in the candidate information. That's very good. But apart from that, also ask if they have taken vaccination or any other prophylaxis for any other condition, right? Because if not, that is something that they can actually go ahead and get. And the other important thing that you can inform them about is medical travel insurance, medical insurance for travel. Basically, a travel insurance, like just in case if they, by any chance, if you do get sick, it can be covered. So for all you guys who are going to be traveling to the UK or are already are here in the UK, you guys can actually look into the travel insurance as well. Just in in the off chance that you end up do getting sick, it will be covered. So yes, so that is also something that you can actually advise, like what to do to be prepared. So you're basically making them prepared, because they are of the impression that it is something that is certain to happen. Even if it is going to happen, the important things are to mention the red flags of what to look out for, the duration of, diarrhea, if it's ongoing, when to seek medical help, if you see any blood in stools or any other symptoms, severe tummy pains and all that, what to actually look out for and when to seek medical help. Because the antibiotics cannot protect you against the wide, vast variety of organisms that can cause, gut infections that may result in diarrhea. So we can't give you protection for everything. You can't be prepared for everything at the moment. And if by chance you do take these medications without any use or any purpose, it can end up causing resistance in the future. So we do not frequently give out these medications like that, so that later on, if a bug that can be treated by the antibiotic does happen to infect you, these antibiotics will be rendered effective, non-effective, ineffective against it. Right. So those are all the reasons to, help you not to give the antibiotics. Right. All right. So let's quickly look at the performance. Dr. Mishi, were you able to mark?
Yes, I was.
Thank you so much. All right. Let's quickly take a look. Okay. So confirm the name and age. Yes, clarify the reason for requesting the antibiotics. Confirm travel destination, specific area in Africa, because if you actually know of any disease that is endemic to that area, you can actually start talking about that particular disease and give prophylaxis for that, for in case maybe malaria is specific to the region where they're going. So you can actually start talking about that, right? Otherwise, confirm travel destination specific area. We spoke about that. Assess duration of stay and departure date. Review previous experience with traveler's diarrhea. Explore plans for local food, untreated water, outdoor exposure. Check if malaria prophylaxis has been arranged or discussed. Ask about past medical conditions, if any gastrointestinal conditions like IBS or IBD that may complicate diarrhea, immunocompromised state, example, HIV status, steroid use, or post-transplant. Confirm any drug allergies and regular medications. All right, points that are partially covered. Determine type of trip, rural, urban, backpacking, resort. I think you actually covered this because she mentioned, right, as a part of my work, I need to go to the rural areas for making that film documentary. Ask about his occupation and if travel is related to work assignment requiring high performance. So these are the very few cases where we actually do give antibiotics. If there is like for an athlete who might be going for a sports meet, you may actually want to prescribe them prophylactic antibiotics because any sickness can actually hinder their work. But most of the times medical team also goes with them, so you can actually advise the medical team accordingly. Ask about vaccination received for the trip so far, like hep A, typhoid, yellow fever. Yep. Inquire if inquire if he has organized appropriate travel insurance covering medical emergencies. Yep, that's also an important point. All right, and important thing, eyes was covered, right? That's good. Management. So yeah, you can actually offer anti-diarrheal meds for mild to moderate. If you are having some diarrhea, so you can actually offer some anti-diarrheal medications like loperamide, which are actually given over the counter. So you can actually advise them to how to take it, right? Explain the use of antibiotics to prevent diarrhea is not routinely recommended due to resistance and side effects. Advise good food and water hygiene, only bottled water, avoid ice, eat well-cooked food. Explain loperamide can be used to manage mild to moderate diarrhea if needed. Recommend malaria prophylaxis if visiting endemic area. Advise consultation for regime choices. Consider standby antibiotics for remote areas, immunocompromised, or history of severe diarrhea. Clarify that antibiotics are reserved for severe cases for specific high-risk situation. Recommend necessary travel vaccination, example, hepatitis A, typhoid, yellow fever, if required for entry. Document the discussion and rationale for antibiotic provision or refusal. Provide safety netting, advise seeking urgent medical help abroad for persistent vomiting, blood in stool, or signs of dehydration. Arrange follow-up if necessary for further travel health advice. Provide travel health leaflets or fit for travel NHS travel site resources. Yep, that's good. And finally, interpersonal skills, sensitive language, signposting, and addressing patient's concern, address his expectations regarding antibiotics, and explain the rationale for not prescribing. Provide yeah, I think it was also here and there. Yeah, provide a clear and concise explanation for all advice given. Reassure patient about the travel preparation and health measures. All right. Yep. Okay, well then, that was good. Thank you so much, Dr. Mishi, for marking. So, and thank you so much, Dr. Ranwali. So anybody, any doubts or any questions regarding this particular case? Nope. All right. Okay, well, let's move on to the last case for today.